Welcome to Medscape. I'm Dr. Andrew Wilner, reporting virtually from the American Epilepsy Society meeting. Today, I have the pleasure of speaking with Dr. Ilo Lepik, professor of neurology at the University of Minnesota in Minneapolis, Minnesota. Dr. Lepik had a very interesting abstract at the meeting, and he's going to tell us about it. Welcome, Dr. Lepik.
Well, thank you, Andy. It's been good to see you again after all these years. And thank you for showing an interest. I've been very active in working in this area of epilepsy and the older adults who are not elder anymore. My major concern is there just doesn't seem to be a lot of interest in what I consider to be a really major problem. There doesn't seem to be a lot of interest among neurologists and epileptologists, but there is a great need.
Just to set the stage, tell us what population you studied and why you studied it.
We got interested in nursing home epilepsy because we noticed that in our neighborhood, our pharmacists were reporting a lot of anti-seizure medication use. So some years ago, we got a CDC grant that allowed us to download data from over 9 million people in all of the US nursing homes for a 5-year period. And this database was a monstrous database. And luckily we had some really good computing power at the University of Minnesota. And this database contained all the ICD-9 codes. And so we're able to look at the actual prevalence and incidence of epilepsy by comorbidity. And we published one of these papers a while ago in Neurology. 7.7% of all nursing home residents have a diagnosis of epilepsy. Now, we suspect these are probably mostly convulsive seizures because in talking to medical directors when I go to their meetings, they're sort of unaware of the focal unaware seizures that probably happen a lot. So these are probably convulsive seizures. We also have the ability to look at falls and fractures and other information. Then we just published in the Journal of the Medical Directors Association incidents, that is, new cases of epilepsy. And we did this by taking 3 years, anybody who'd been in a nursing home for 3 years in our 5-year data set, who didn't have epilepsy to begin with, and then developed epilepsy sometime during the 3-year course. And we found that the incidence, new cases, were 16 per 1,000 per year. And that incidence is much higher than has been reported in the outpatient older adult population. So the issue is that epilepsy is very common in nursing homes. And so that triggered the issue, what are nursing home doctors doing about it? What's their level of knowledge? What's the level of care in the nursing homes? So about 2 years ago, just about the time COVID hit, we developed a questionnaire that we were able to administer over the internet. And we had basically two things. Our hypothesis was rural versus urban difference in practices. And the second was just to gather information. We had so bottom line, the results were that we ended up with roughly 69% urban and 31% rural, which is enough that we could actually do statistics on it. We limited the responders to medical directors of nursing homes. We initially thought maybe we'd do nurses, et cetera, but we thought that we'd get most of the information there. I think a major finding, which sort of shocked us, was that only 52% of nursing homes actually had a protocol to deal with seizures.
So this is about almost, I think it was 91 nursing homes. Now, were they all in Minnesota or all over the country?
No, actually, these were 91 medical directors who responded. I think the one thing that sort of disappointed us was the low rate of response. And we suspect people are just too busy with taking care of their own COVID issues. This is nationwide, and we do have a breakdown. I have a map of the United States, which we didn't show at the meeting, but states like California, Texas, New York had the most responders. Some of the rural states had maybe one or two responders. So it was a pretty much nationwide.
So if they don't have a protocol, that means that the nurse sees the patient have a seizure, and so the nurse would call the doctor, and he would do whatever he does. That's what I am envisioning. Is that right?
If they have a protocol, that's not so bad. But half the time they just sort of start scrambling, and it is a pretty scary thing to them. And I think the one thing we learned, uh, my talking to them at meetings plus doing a survey, was that they're not prepared to deal with epilepsy or seizures happening most of the time. So
even though 10% of the residents approximately have seizures, right? It's close to 1 in 10, right, in the nursing home.
yeah, the problem is when you boil it down, we also had data on how many people do you have in a nursing home, and most of the nursing homes had maybe 200 people in them. So if you do the 7%, you're still not having a lot of people. There's a lot of missing information. How often do people have seizures in nursing homes? We don't know that. So even though 7% have a diagnosis of epilepsy, how many, maybe they'll go a year or two without a seizure, even though they've had a seizure. So we need to do more studies as to what is the actual probability of having more than one seizure. The other problem is that unlike people in the outpatient setting, we did have a relatively large fall off in patients in the study. So at the end of 3 years, we had maybe only half the people that we started out with. And most of those were people who were deceased. So number one, there are an awful lot of patients who do have epilepsy, but we don't know what the frequency of seizures are, and we don't know, how upsetting it is. I think the other thing that we found is really very fascinating was one of the questions we asked was, how often do the patients or guardians of the patients want transfer to a hospital? And it was amazing. After a single seizure, 66% of family or guardians says, take him to the emergency room. The doctors really didn't want to send him to the emergency room. So there's a little bit of an issue there. And we found that an actual transfer to a hospital only occurred in 7.7% of people who had a known neurological disorder known to predispose to seizures. So if somebody had a stroke and they had a seizure, most of the time, more in rural than urban, they would just keep them in a nursing home. Whereas in urban areas, the doctors I talked to said, if we don't send them to the ER, we may get sued. So that plays a big role. There's a real concern among the nursing home physicians about being sued. I take care of pediatric and adult, and I have a saying that in pediatrics, it's the adult parents of children that give you a hard time. In the elderly and older adults, it's the adult children of parents that give you a hard time.
Now, suppose I'm a medical director of a nursing home and I happened across your study and I don't have I say, gee, this guy Lepik, he says I ought to have a protocol and I don't have one. Maybe I should get one. Where do I get one? How do we fix this problem?
Well, that's really the idea of the study, was to find out what the need was. And one thing we found in the survey was a very large number of nursing home directors would love to have educational programs. So our hope is that based on the information we have, we will hopefully develop some kind of educational program for nursing home directors that they can use in a nursing home. Almost all the directors I've talked to outside of the survey were just absolutely thrilled that if somebody would come by and develop some kind of educational programs, that they could use, that they would be very happy. Most nursing homes, the other thing we found out that most nursing homes don't really have educational programs for their nurses. And there's a high rate of turnover of nurses or caregivers. And so there's a huge need, we think, that an educational program developed in conjunction with perhaps the American Epilepsy Society and nursing homes would be a great benefit.
Dr. Lepik, this has been a great discussion. I want to thank you for sharing your research with Medscape. Before we close, is there anything you'd like to add?
Well, the other startling thing that surprised me was I thought that after the seizure, anti-seizure medications would be started. We found that more than half the time in a patient with Alzheimer's with a first seizure, nursing home directors did not start an anti-seizure medication. I think they were quite aware of the fact that sometimes with people who have Alzheimer's, the anti-seizure medications may cause more problems with cognition and behavior. That it's worth treating an occasional seizure. In roughly 30% of the non-Alzheimer's, they would not start an anti-seizure medication, which I thought was very interesting.
That is interesting. And since that's each case has to be individualized, treatment or no treatment and which drug, and well, you're a world expert on that. So maybe we'll learn more about that next year at AES.
My biggest concern is we just don't have a lot of interest in the older adults in the American Epilepsy Society. The IALE has recently set up a commission, but we're all getting older, and there's no question that 1/3 of new epilepsy cases will happen in people over 65.
Well, Dr. Lepik, thank you very much for sharing your research results with Medscape.
Well, thank you, Andy. This has been very helpful.